Okay. Come in.
Hi there, I'm Reed McKee. I'm gonna be your student nurse today. Starting off, how are you feeling?
Pretty good.
Good. I'm just gonna go over here and wash my hands. Scrub. So today we're going to be doing a peripheral vascular disease or vascular exam. Basically that just means I'm gonna be feeling a couple pulses, a couple places. I'm just gonna be making sure that blood's getting all over your body and there's nothing that we really have to look at that goes any further than that. Is that gonna be okay with you?
That is okay with me.
Great. Could I just check your arm? Could you say your name and date of birth for me?
Sean Huntermaker, August 25th, 2002.
Great. Nice to meet you there, Shawnee. Patient appears cognitive, upright, content, and ready to be assessed. Have you ever had any peripheral vascular diseases or complications in your life before?
I do not think so, no.
Okay, great. So I'm going to start off just by pulling up your sleeves real quick. All right. Okay, arms are symmetrical in size and color. Color is slightly tan, palish pink. There do not appear to be any gashes, bruises, cuts anywhere across either arms. Okay, I'm going to see your hands real quick. Hands are dry, smooth, and warm. Okay, now actually, so I'm going to see your hands one more time. 1, 2, okay. Capillary refill level 2+. The capillary refill is symmetrical and refills at a expected rate. Okay, now I'm going to check your pulses, all right?
Mm-hmm.
So could you put your hands kind of like this for me? All right. All right. Okay, radial pulse is 2+ and symmetric. Now, I'm sorry, brachial pulse. Now I'm going to do the radial pulse. Okay. Radial pulse is 2+ and symmetric. Great. Now, if you don't mind, could you please stand up and remove your pants for me? All the way off. It'll just be for a quick second. Don't worry. Done this exam thousands of times. You got nothing more, or nobody else you can trust more. Okay, sit back down for me. Okay. So again, legs are slightly hairy, slightly lighter in color, pale-ish pink, slight tan along the calves. There do not appear to be any lesions, cuts, bruises, bumps, masses across either leg. All right, could you just lean back for me? I'm just gonna check a couple pulses. All right, starting off with your femoral pulse. Right here. It's all right, I promise. This is a professional. Okay, pulses are symmetric. Femoral pulses are 2+ and symmetric. Great. Now I'm going to your popliteal pulses. Your popliteal pulse in your right leg, I would say is 1+. Yep. Consistent. Okay. Popliteal pulse in right leg is 1+ as well. Or popliteal pulse in left leg is 1+. Popliteal pulse in right leg is 2+. Now, I'm gonna take these socks off for you. Sir, I assure you this is all protocol. All right, now I'm going to be checking your dorsal pedialis pulse. Okay, here I'm going to have to do this bilaterally. So they are symmetric. Pulse is 2+. Now for the last part, I'm just going to check your posterior tibialis, I think. And those are both symmetrical 2+. All right, Mr. Hunterbricker, that concludes our peripheral vascular exam. You got blood going all over your body. You're looking good, man.
Thank you very much.
Thank you so much for coming in today.